Perfect. Good evening, everyone. Thank you so much for joining today's call, where we'll be going over the 2025 Brain Injury Day legislative asks. We have an exciting agenda coming up. If you are one of the 392 folks who have registered to attend our conference, thank you. We're so excited to have you there. If you are an ally or coalition member or someone who's still advocating from home, there's plenty to do to step behind our legislative asks, and we'll hit that on a little bit. Before we dive in, just a few housekeeping things. There is no chat enabled, but if you do have a question, please submit it through the Q&A, and Zeta and I will get to that as quickly as we can. There will be a few moments at the end of our presentation to answer any questions, but if there's anything burning that pops up, please feel free to put them in the chat. All right. And this is who we are. Zeta, would you like to introduce yourself?
Sure. Hi, everyone. It is such a pleasure to be with you all and appreciate our partnership with BIAA to be able to do this. My name is Zeta Ricker, and I am the Director of Strategic Partnerships and Policy for the National Association of State Head Injury Administrators. See a lot of familiar faces on the line, but for those of you who don't know NASHA, we are a membership-based organization made up of the state brain injury programs within each state and their partners, including often the brain injury affiliate organization, advisory council members, providers, and others. And it is really our goal to help to support collaboration within the state so that we can strengthen the ability of state systems to meet the needs of people with brain injury and their support systems. And it's a pleasure to be with you all today.
And hi, folks. My name is Denver Supinger. I'm the Director of Advocacy and Government Relations for the Brain Injury Association of America, the voice of brain injury. We are the national organization uplifting our survivors and their communities' voices on Capitol Hill and above. We also carry out our work with over 30 state affiliates across the nation who are touching the lives of our brain injury survivors and their support system every day through information referral, case management, and more. So very excited to have you all here. Thanks for joining us. All right, so we're going to first jump in about why we're on the Hill. We are in a completely different presidential administration, and a lot of things are changing, but regardless of who we are operating under, whoever's in the president's office or at the head of any agency, brain injury needs to be on the top of the agenda. We have millions of Americans across the nation who have brain injury but are not seen for the whole person that they are. They don't receive the proper care or support they need, including services on the ground. The current CDC number, which may be updated soon, is there are 5.3 million Americans living with a disability related to brain injury in the nation. And we know every 9 seconds, one person in America experiences a new brain injury. Our population is vast. Brain injury does not discriminate against race, gender, ethnicity, state, rural versus urban, anything, right? It hits everywhere. And it should be a major public issue. We know brain injury, if you've seen one, you've seen one. Yet across the nation, brain injury is understood as a once in a hit of the head incident, you go to the hospital and you're done, right? There's a lack of general understanding, especially through our federal agencies, of the depth and breadth of our community. So we need legislators to listen to us. We go to Capitol Hill to share your story. You all have been on the side, on the playing field through and have had a lifelong of experience in this area that legislators have never heard or touch of. We do have a fabulous representative democracy, but people know what they only know, right? And it's up to us to educate and empower legislators and to tell them that brain injury is a top issue and a very important issue for us to take on. Additionally, we know that folks are struggling with day-to-day without proper care. And our legislators need to see that picture live in their face. We need to make sure they know their life, that brain injury is a chronic condition. It's something that travels throughout the lifetime, and we should have support systems that travel throughout our lifetimes as well. So, that's being said, as we are going to Capitol Hill and making allies and sharing our stories, we are so blessed to have a body bicameral, so both the House and the Senate join together on these efforts and come together to learn about brain injury issues. And that is through the Brain Injury, uh, Congressional Brain Injury Task Force, excuse me, or CBIT. This is the body that brings parties from across the aisle and across the Capitol Square from the Senate and the House to learn more about the brain injury community, to find ways to empower the brain injury community and to uplift them. These are our experts. These are our number one advocates. Their staff are well read on our issues and are helping their members of Congress fight for us. Um, their general mission is there before you, but funding basic and applied research, rehab, and development of a cure. These are folks who know and are ready to take action. Last year, we had new leadership than we had this year. We had Congressman Pascrell from New Jersey and Congressman Don Bacon. Unfortunately, we suddenly lost Congressman Pascrell in fall of last year. And he was our champion from the get-go. He was the man who brought the TBI Act to the floor, which you'll hear a little bit more in the 80s. And he was the heart and soul of this task force. Don Bacon was a great advocate in the medical field as well. But after the passing of Congressman Pascrell, Congressman Don Bacon decided to take a step back and let new leadership come forward. So we are very excited to have two new congressmen step forward. We have Congressman DeLuzio from PA 17, and then Congressman Morgan Luttrell, who is the only congressman that we know of in the House of Representative that has a TBI and is leading through with a TBI. His fun fact, his brother was one of the main characters in Black Hawk Down. He comes from a military background himself and understands the realities of brain injury in both the veteran space and in the civilian space. And DeLuzio, once again, also has that veteran background and is really impassioned about health issues. So as I already talked about, this is our heart and soul. And I bring up the Congressional Brain Injury Task Force because it will be one of our legislative asks, so I'll circle back to them. But these are our folks that propose our legislation. Last year, our Congressional Brain Injury Task Force and the chairs were behind the TBI Reauthorization Act. They are folks behind appropriations asks, excuse me, to keep funding for our brain injury programs across the board, whether that's through the CDC, Center of Disease and Control, National Institute of Health, or administrative community living, or more. These are also the folks that take our advocacy beyond the next step. We can set up meetings, send emails, send phone calls, but we know even in our own life, those real connections happen when we have a one-on-one conversation. And our congressional task force members are those on the House floor, the Senate floor that are educating their colleagues about these issues. They write Dear Colleague letters to educate as well. And of course, they assist us with our Capitol Brain Injury Awareness Day on Capitol Hill. This year, we are having a rallying event at the beginning of our Capitol Day on Thursday, the 5th, excuse me, where they'll be kicking us off, setting the priorities for the year, and hearing voices from folks like you about why these issues are so important. Just as a quick overview, these are our current members. We did have an election last November where some of our members did not cross over. So we are a little light on this than we were before. And with that being said, we want to see all 435 members of the House and 100 senators come together and be part of this task force. That's the goal, dream, everything we're shooting for. But it has to start with us educating, telling them that this exists, and saying why it's important. And that's why one of our first and probably our easy access ask for our day on Capitol Hill, we'll be asking our members to join the Congressional Brain Injury Task Force. We want them to be more than a rubber stamp on a task force, but to be an active member, an active listener, and an educator across the board for brain injury. So get ready for this. If you have any questions about CBIT, please let me know. but we will transition to our next ask with Zeta.
So our next ask will be to reauthorize the TBI Act. I just wanted to piggyback on something that Denver shared at the very beginning about why we're here on Capitol Hill, and remind folks that when you are doing meetings on Capitol Hill, that it's really important to share that why at the beginning. Denver and I learned early on, as we've been advocating on the Hill, that there are a lot of folks across both parties and both chambers that don't have even a basic understanding of brain injury. And so I do think it's really important kind of at the beginning of a meeting to level set about what brain injury is and why this issue is important to you, and then go into our asks, including for the Congressional Brain Injury Task Force, and also for the TBI Act and the other asks that we'll have. So we're going to just dig in a little bit on the TBI Act. You can go to the next slide. So the TBI Act is the only federal piece of legislation which is focused on domestic programs that support people with brain injury. It authorizes the CDC, the Center for Disease Control, and the Administration for Community Living, or ACL's, brain injury activities. And it really helps to ensure that programs are protected. Currently, the TBI Act is not authorized. It expired on September 30th. And this is challenging because we know that Congress and the administration are looking at all of our various programs and determining what our priorities. And so it is essential that we reauthorize the TBI Act as quickly as possible. We are really grateful to have bipartisan support and bipartisan champions, and we can go to the next slide. In the House, Congressman Menendez, who is a newer member, is going to be introducing the House version of the bill with support from the ranking member of the Energy and Commerce Committee, which is the committee that will lead this effort in the House, Congressman Pallone. They will both be leading this effort. In the Senate, Senator Mullen, who was our champion last year, will also be leading this effort. Senator Casey was our longtime champion and unfortunately did not win re-election. And so we're working to secure a Democrat for the Senate. We'll also have support from our Congressional Brain Injury Task Force, and know that there will be others likely who will join the effort as well. But these are our key champions. And I will say I'm very excited about our champions and their willingness to push, and the support that we've heard from the relevant committees on the Hill as well. So there is a lot of momentum, but we really do need your voice to help to push it across the finish line and to find a pathway forward to pass the bill. Next slide. So just quickly for some background on the Administration for Community Living State Partnership Program, which is one of the two main programs that are authorized in the TBI Act. This is a program, as many of you know, that provides grants to states, tribes, and territories through the Administration for Community Living, and it works to support a central state program that really focuses on people with brain injury and their families. Oftentimes, without this funding, a state would be unable to have a person within the state that's thinking about brain injury and focused on coordinating cross systems. We know brain injury is in overlaps with many different spaces like behavioral health, public safety officers. And so this grant is really essential to help ensure that there is that statewide coordination and that there is someone in the state that is thinking about this. And it also helps to provide some state capacity and services in some states. Next slide, please. There are currently 31 states that receive funding through the state partnership program. There are only $200,000 year grants. They're very small grants compared to other federal funding. And all states provide a 50% match, which is one of the highest matches, or I think the highest match of any ACL disability program. Just wanted to give a couple examples of some states and what they do, and just as a way to highlight that if your state is one that has a TBI state partnership program grant, it may be good to share an example of some of the activities. So in Pennsylvania, the grant funds their resource facilitation program, which provides case management services for people 18 and older and their families to help them navigate resources. And the state partners with the Brain Injury Association of Pennsylvania to do this work. And in Maine, the state partners with the Brain Injury Association of America Maine chapter and other stakeholders to plan and deliver services. And that grant also has a focus on supporting people with substance use and behavioral health challenges within Maine. Again, these are just two examples. Also want to share, everything I'm sharing is just so you all have context. We know you have maybe 15 or 30-minute meetings, but questions may come up, may have or need additional context. So I wanted to make sure you understood the full picture. Next slide, please. So the state partnership program grants are used for a number of different things, including to expand and improve state capacity, as we mentioned, like ensuring there's someone within the state that's hired to focus on brain injury, helping to connect individuals to community resources, or providing brain injury resource facilitation. Sometimes it's used to help collaborate with other state agencies who we know are also serving people with brain injury. Some collaborations that we think might be particularly interesting for Congress is supporting veterans who might not be able to seek care from their VA or other systems. Law enforcement officers, as we know, that's a priority for this Congress and administration. And supporting children and youth and older adults. And the funding is also used to help support brain injury advisory councils. Next slide, please. This is from the last report of what different types of services are provided under these grants. So 60% of grantees conduct brain injury screening in some way. 60,000 or more than 60,000 people have received brain injury resource facilitation or support through these grants, and grants are often used to train professionals on better supporting people with brain injury. Next slide. Research shows that people with brain injuries who live in states with TBI state partnership program grants experience better long-term outcomes compared to those in states without these grants. And that is a statistic that we have found to be pretty impactful as we're talking to people on the Hill. So wanted to share that. And they really do have such far-reaching impact within states. The other program that the TBI Act helps to authorize is the CDC TBI programs. And CDC does a number of different things within their TBI program, including the Heads Up campaign, which is educational resources for coaches and athletes as they look to ensure a safe return to play. Youth concussion guidelines in helping to ensure that there's the best care post-concussion. It also does a lot of work in workplace injury. Next slide. And CDC is also essential in collecting data, including the National Concussion Surveillance System. As you all know, I'm sure the national data we have currently is not sufficient, and oftentimes has data that's coming solely from emergency department or hospital visits about who has a brain injury, and that is not reflective of the many people who don't seek care or don't go to emergency department or hospital, or who aren't reported because they maybe had a brain injury and their broken arm was reported, but not their head injury, for example. And so the National Concussion Surveillance System is a national survey to help us understand how many people in the country actually have a brain injury. And we know that from the last NCSS pilot, 30 times as many adults had a brain injury and 17 times as many children had a brain injury as previously reported. So it's incredibly important that we have this data collection. Next slide, please. So the TBI Act looks to authorize these two really important programs, and it authorizes them both at level funding and does make some small changes. Next slide. It first focuses on supporting systems of care for people under the ACL program for any type of acquired brain injury, so not just traumatic brain injury. As I mentioned, states have a 50% match, and this legislation would allow a state to request a waiver of the match if they cannot meet the match to carry out the grant purposes. This can only be for new states. And it requires ACL to take into consideration populations that might be at higher risk for brain injury. Next slide, please. It also reauthorizes the National Concussion Surveillance System and the other CDC programs, and requires an examination of brain injury as a chronic condition, which we know is happening through some work with the National Academies of Science, Engineering, and Medicine already in the week just after we will be on the Hill. Next slide. So the TBI Act was included in a health package that came together at the end of 2024, and that was these changes that we just talked about in a very bipartisan compromise way. Unfortunately, due to reasons outside of the TBI Act, those pieces of legislation were not included in a bill, and so now we're working to just advocate for the TBI Act to be reauthorized and are hoping to find some kind of moving the vehicle or mechanism for it to be passed. And again, I want to say, when you're having meetings with members of Congress, you can really just focus on reauthorize the TBI Act and talking about the impact of that work in your state. If you're a state who has a TBI Act grant, or a state that doesn't, but what you could use with it. Just wanted you to have the full context. So if questions come up, you know, different members of Congress have different kind of questions. I also do see a question about how can we find out about what our state is using ACL TBI grants for. I will share with you a guide that NASHA has put together that highlights what every state who has a grant is doing with those dollars, and that would be a good resource for you. And Denver, please jump in if I've missed anything on the TBI Act.
I think that's great. We're going to talk about some more vehicles in just a moment, but know that we are fighting from every angle to have this reintroduced and passed as soon as possible. I know it's sounding that it's not reauthorized, sounds very terrifying, but our programs are continuing until we have a new directive or a new budget bill as well, which we do not. We have a continuing resolution, which is a resolution that sets the standards for a certain amount of time in the government with our budget, with our appropriations. So things are continuing. It's just we want to make sure it is reauthorized and stays in law for at least the next 4 years. Oh, Zeta, do you want to hit this? I can hit this as well. So our pitch in general is we need to reauthorize the TBI Act as soon as possible to overcome that concern, that we want to make sure these programs continue and are well supported. To ensure that our data points are collected and that our care for our brain injury population across the country continues. without doubt. All right. If you tune into CNN, Fox, NBC, MSN, any national news, I'm sure you've heard about the reconciliation process. If not, don't worry about it. You're probably more sane than the rest of us. But the reconciliation process is upon us. And this is one vehicle that we is been taught to be as a point of consideration to attach the TBI Reauthorization Act. So what do we mean attach? All right, reconciliation bill is a larger package. And just like a packet of paper, I can take this, put oh my gosh, I'm blanking on it, the little put a staple to it and staple a new bill to it, right? And that would, that entire package is now the original package plus that. Think about that when we say add to the package, add to the vehicle. It's literally just adding another provision on the back of things. Does not take away or give into the original package focus, but it's adding other things to authorize that may have been overlooked or what have you. So one of the processes is the continuing resolution. So continuing resolution is what we're in now. Congress has still not passed a budget bill, but they've passed short provisions to get us from one deadline to another. Our current continuing resolution, and Zeta, correct me if I'm wrong, expires midnight on March 14th. So we're up for a new one very soon. And we're up for a reconciliation bill. And a reconciliation bill is a special legislative process that advances federal legislation, right? Advances spending, revenues, federal debt limit. It sets the policy and priority of the Congress and their, our at the end of the day, you can say, if you want to know where someone's values are, look at the budget, right? You budget for what you need. If you don't value health and fitness personally, you might not spend $200 at a gym, but you might put that to family time, right? That your budget, your dollars speak to your values. And that's what we are looking at in Congress. So this sets a new fiscal policy and priorities, was last used in 2017 for tax cuts in 2021 for COVID release. And we are hoping, as I noted earlier, that this might be one vehicle that can be used to pass the TBI Reauthorization Act, that and or the continuing resolution. And as a final backup, we will be introducing the bill as a standalone bill, which will have to go through the entire legislative process. All right. This is our big ask. So as I noted earlier and Zeta hit on, the TBI Act is the only domestic piece of legislation focused on the brain injury community. We do have legislation and policies that focus on our active military and veteran space, but outside of this, this is the only piece of legislation that's solely targeted for our community. And honestly, as someone who's been in this space, I think that's unfair. We are, as I noted earlier, a community of millions and millions, right? It's not just us who, are individual survivors who are impacted, but it's their family, their workplace, their loved ones, their entire care system that's impacted. Yet there is no federal prioritization of the brain injury community. And that includes no prioritization of data collection, of understanding the continuum of care, providing proper care, and more. So we are proposing in 2025 a National Brain Injury Action Plan. This proposal will create a national strategy to improve treatment, research, and services for those who have experienced brain injuries. It will ultimately help doctors better diagnose and treat brain injuries. It will help support survivors and give them the care they need, support their family structure as well and support structure. And it ultimately will reduce the cost. And we'll hit on that a little bit about how things are currently structured in the federal government. So, what is the state of the world? Why do we need this? So, as I noted, we are a vast depth population that hits every creed and corner of the nation, right? And there are several agencies throughout the government, and there are many agencies that hit on brain injury. As we heard, the CDC has a program, Center for Disease Control. ACL has a grant program. National Institutes of Health has various research programs in various institutes happening. We have the Center for Medicare and Medicaid, which has their own programming in a way of touching brain injury. And that's just the top, part of the iceberg. It trickles down in many more. Yet, despite all these agencies touching our community, hoping to advance in our community in some small way, there's very little coordination between them. A lot of federal agencies are operating in silos, which means that there is no data share, there's no best practice share. If one agency learns about a new issue facing the brain injury community that they can fix, that stays in that agency. It's not said to the entire federal government, say, hey, this is an issue, how can we collaborate, right? There's no space to bring that brain trust, bring that energy, resources, and time together to focus on the brain injury community and make change. Additionally, there are no best practices or standards, right? Everyone kind of just does what they can, and we understand there's little nuggets of knowledge everywhere. And we can only imagine how huge that pot of gold is if we get all those nuggets together. Um, and what we also see is brain injury is not a federal priority. We touch millions of lives. But we know ALS had a huge campaign a few years back, but their general population is a fraction of ours, right? But federal government has priorities, they have research, they have dollars right to this. We have allies who have similar population numbers to us, like Alzheimer's and autism, who have done things like this, who have gathered federal agencies to create change and make it a federal priority. As I started off in the beginning, our legislators, our federal agency leaders only know what they know. And it's upon us to raise the priority and the statute of brain injury. And a national action plan is the way to do that. And then finally, as I'm sure, as we all advocate in our community, brain injury is vastly misunderstood. People see it as an acute issue. People don't understand the continuum of care. People don't understand the vastness of the community. And having this one avenue to prioritize our community is going to fix that. So at large, it is a plan to improve diagnosis, treatment, and long-term care for our brain injury community. This national action plan sits with the Secretary of Health and Human Services and under his office. Under the Secretary of Health and Human Services is an advisory council. This advisory council, we'll go into this in a little bit, is made of several federal agencies and community members who lend their expertise, their direct programming to understand what they're doing and providing brain injury community and to understand where there's gaps and opportunities. So they're charged with doing an assessment and making recommendations. These recommendations come to Congress on an annual basis through an annual report. And we are slating this to happen between when it's enacted, hopefully in 2025 to 2030. And this might sound like a quick turnaround. Why only 5 years? We need to put a fire underneath federal agencies and their actions. If we put this in perpetuity, people can take 18 months to get a memo of understanding between various agencies, which is great. We need it. But if we have this charge that things have to happen within a 5-year window, we will see greater investment, greater understanding, and greater support for the National Brain Injury Action Plan and improvement of these programs. So I noted it's under the Secretary of Health and Human Services, HHS. So HHS secretary or his designee will be responsible for creating and maintaining this action plan. So first we need to do an assessment, right? What's out there, what's happening. And then with the assistance of the advisory council, the secretary or his designee must provide information and coordination about researches, services, and more across the federal agencies. So how are things happening and how we can improve? So I noted that there are a lot of stakeholders at the table, and this is the list of them. I alluded to that there are so many federal agencies that touch brain injury And I wish we could have every single one because it's more than this, but these are some of our highest hitters. So some notable folks is the Center of Disease Control, where our current brain injury programs lie, Administration on Aging and recognizing that brain injury is prevalent in the older adult population, Center of Medicare and Medicaid, and recognizing those are huge support systems for those who qualify, and we want to make sure that we are collecting the right data through those systems, and we are putting the right provisions to make sure people have proper care. Director of National Institutes of Health, so the agency that helps with all our research around the space. Veteran Affairs, which is huge. We know that our veteran and active military members encounter brain injury at a higher rate. And despite in addition to them being able to receive healthcare and support from VA facilities, we recognize that once an active duty member comes back and becomes a veteran, there are barriers for them to access VA care. That includes a barrier for them to either access a facility due to location or with referral timelines. We know in the brain injury community, we want our survivors to seek care within the first 6 weeks, and it's proven to help them more if they do have them in the first 6 weeks. We know some VA waiting lists are up to 6 months. So a lot of our veterans are seeking civilian-based care. So we're hoping to translate a lot of what's being happening in the military and VA space into the civilian space so we can grow together. This includes, and then in addition, Agency for Health Research and Quality. Department of Education was huge with hitting on our youth and setting those standards for our school systems. Administration on Disability, Department of Defense we talked about, and various institutes under the National Institute of Health. So we're trying to get every federal agent that we can, that we think has relevancy to this table, to then also partner with community members, which you can say here. The federal government can set standards and think they are doing the best, but we know, as we kicked off this meeting, that the stories, the voices, the real experiences is what impacts and moves priorities. So we have survivors, caregivers, healthcare providers, model systems, brain injury programs at the state level, researchers, health association, and national organizations that will be will be part of this advisory council, but we'll be pushing these federal agencies to think a little deeper, think a little wider, and to make sure that the priorities before they put in the National Action Plan are the priorities that are important to the brain injury community. Because that action report that they produce every year will say, we need this legislative change, we need this internal agency change, and we need these agencies to increase collaboration here. And they will set those, note those needs for change, but also set a priority. They say, okay, well, maybe right now we need to fully fund the National Concussion Surveillance System. So that's number one. And maybe we need to put more research dollars in NIH and target that to X population. Maybe later down the road, maybe in year 2 or 3, we're going to look at the classification process for brain injury and setting that standard so we can do this step by step and not overwhelm our community, our advocates, and we do things in a very moderated and consumable pace, excuse me. So overall, what is the scope? I've talked about this plan, why we need it, who's going to be there, what is the scope? So at the end of the day, we want to accelerate development or treatments that would prevent, halt, or reverse the course of brain injury. I think that's our standard, right? If we can stop brain injury before it begins, if we can prevent it, if we can provide support systems, that's what we need to do. We are here to get people from where they are to a new, wonderful, strong next step of stable of life, whatever that looks like for them, right? And we need support systems to get there. So to do so, we are looking for the National Action Plan to evaluate the prevalence and prevention education of brain injury. Any screening tools, look at screening tools, best practices, tests, and protocols. As you may know, there's no one nationally adopted screening tool for brain injury. We would love to see that. We would love to see that there are step protocols for screening and testing brain injury and for the federal government to take a lead there. Classification systems to define the severity of brain injury. Right now, brain injury is boiled down to three things: mild, moderate, and severe. If we translate this to the cancer community, if I said you had mild brain cancer or mild breast cancer, what does that mean? Right? How do I know what proper care you need, what type of doctor support system you need, how long you might need workers' comp, or not workers' comp, paid leave or sick leave to treat yourself, right? How do I prepare your family and your loved ones if I just say you have mild breast cancer? Um, Same thing with the brain injury community. We need something stronger to define so we can really nail in with proper care for our brain injury community. And then also data collection through medical coding, which is its own nuance, and I won't get into that, but we need to make sure that the data that we're able to collect through the Center of Medicare and Medicaid, through our primary care physicians, through our hospital systems, we know whatever is being treated. If that was caused by a brain injury, we can quickly link that back to a brain injury. So we understand the continuum of that person's experience. Because we know that when you have a brain injury, you might not feel the symptoms or see the symptoms of it until months down, years down the road, right? So we have a better classification system that says, I'm treating PTSD in a veteran, but I recognize it's linked to a TBI they experience while in active duty. It provides a better picture and a more holistic way of caring. Also, we are looking to improve data sharing. Through the federal agencies. I've hit on this already. We want to make sure that if we have all these nuggets of gold across the federal government, we want to bring it all into one huge pot. Coordination of care for treatment, which states for itself, availability for post-acute support systems or social services within the community. We recognize, Zeta noted that a lot of our data comes from hospitals and that acute care, but there is still a whole life to be lived outside of a hospital setting. And we need to make sure that that care outside of that hospital setting is accessible to all. The surveillance, registration, and data collection on the number of brain injury citizens and their life progression. The National Concussion Surveillance System has only been a pilot. If we can keep that up and have it as a regular system, that would be huge for our community. And also, if we are able to register folks, like have a registry or have a larger database where we can see their transition across life, or we can provide resources to folks because we know where they are, that's huge. Understanding the metrics to understand burden of disease. As I noted, CDC has been using 5.3 million Americans have been living with a brain injury or are living with a disability related to a brain injury. Great. That number has been the same since the 80s. And the surveillance system noted that what we understand is completely off to the reality, right? It said adults are 30 times more likely to have a brain injury, traumatic brain injury, granted, and kids 17 times more likely. If we translate that to the 5.3 million, my goodness, we're talking about a completely different population number. And then finally, supporting brain injury research and research investments. This is private and public to make sure that we are supporting and providing a whole picture, a whole support system for our brain injury community. And I keep talking, and Zeta has a whole new part, so I'm going to go up over here. So our first step is to analyze the current state of brain injury research programs and coordination, and then the advisory council will analyze that and and then create recommendations for improvements. That's step 2. And then in step 3, we will see those recommendations and prioritizations in the National Action Plan and a report every year sent to Congress. So ultimately in this, and I kind of broke this down a lot with looking at where we want to improve, our pitch is that brain injury awareness services and support must be a focus of Congress and federal agency. Our community is dynamic and we reach across all angles in which the federal government does as well. So there needs to be a point of coordination and collaboration with these folks. We need ultimate federal leadership. We need a point that says we understand brain injury and this is what we're going to do with this. And that's what the National Action Plan does. And then finally, we want to streamline our research and services so we can both elevate care and save federal dollars. You can only imagine how many duplicative items are happening across the nation. If we can bring that all to one source, we can possibly see millions and millions of dollars of savings, right? Let's streamline and put brain injury first and elevate this space.
Thank you so much, Jennifer. I'm really excited about the National Action Plan and the vision for the future in supporting people with brain injury. I'm just going to very quickly go over our final ask, which is our funding requests. We can go to the next slide. So our final ask is to increase funding for the programs that were authorized in the TBI Act, which we've already gone into a lot of detail on, as well as the TBI model systems. Next slide. So currently, the state partnership program and the protection and advocacy programs at the Administration for Community Living are funded at $13.1 million, and we are hoping to see $25 million. That would allow every state to have a state partnership program grant. We are also hoping to see an increase in the TBI model systems and are hoping to see an increase in the CDC TBI programs so that there can be $5 million specifically allocated for the National Concussion Surveillance System. And next slide, please. So again, I think you can use a lot of the same talking points as when you talk about and share the information on the TBI Act. We're just hoping to see the funding for those programs also increase again, so that all 50 states would be able to receive funding from the state partnership program. And so that CDC and the TBI model systems could have the funding that they need to be able to do their great work. We do expect that there will be congressional sign-on letters. So how the Appropriations Committee often decides what they're going to fund is by looking at what members have requested. And one way that members request their asks is through a letter to the appropriators. And every year for Brain Injury Awareness Day, we typically have a sign-on letter that we ask our members of Congress to sign on to. We are expecting that our Congressional Brain Injury Task Force members will be leading that letter and are hoping to get confirmation on that language for them soon. And so would ask that in our meetings that you ask for an increase in the funding for the TBI Act and ask that they sign on to the appropriations letters. And we'll have more details for that ahead of Brain Injury Awareness Day when we do our pre-legislative briefing. But you can also always say that we will follow up an email with more details on the appropriations letters, and we'll make sure to get that so that individual members can sign on to that letter. Next slide. Denver, I think it's back to you.
It is. With a new directive set by the voters in November and a new administration, a lot of things are changing. So, as we put these priorities ahead of you, our four ask, our funding ask, our Congressional Brain Injury Task Force, the TBI reauth, and the National Action Plan, we want to recognize and admit that there needs to be flexibility, right? Things might change tomorrow. So we will keep people abreast and updated on folks, but this is our streamlined vision for now and what we will continue to advocate for. If tomorrow we see any drastic changes, it might change as well. We do think the National Action Plan will be definitely, well, we know it's going to be introduced this year, and we'll have bipartisan support, so we are comfortable with that. But if any funding asks change or anything else, we want you to stay engaged with us. You can sign up for BIA advocacy or also the national newsletter to be aware of what's happening. We're just in a very dynamic time, and we ask for your grace and some flexibility. All right. With that, we have about 8 minutes for questions. So if you have questions, please put them in the Q&A. And I'll look at some that we have. So an easy one that noted was who will be choosing the members for the advisory council for the National Action Plan. That will be under the discretion of the Secretary of Health and Human Services. Historically, there's been an application process for folks where they review or referral process. So if you are interested, once this is passed, let us know. We're happy to pass that information along. But that it's under the discretion of the secretary. All right, what else do we have here? So, Tom, the this will be posted online, so there will be a link for you to watch back this presentation. We also, it needs to be a little bit refreshed, which will happen tomorrow, but we also have our talking points one pagers on BIA's website. And I can also send that to you directly, but I'll make sure everyone who registers will do a quick follow-up email with the proper links and talking points.
I see a question about, will acquired brain injury be included in these priorities? I know it can be frustrating when you see TBI, but I promise you we do mean acquired brain injury, all types of brain injury within these advocacy priorities. Unfortunately, the program is authorized as the Traumatic Brain Injury Act, and it's most beneficial for us to instead advocate that the programs support people with all types of brain injury, regardless of mechanism, rather than changing the name of the act. But it is the intent. Currently actually is allowable to support people, and the intent of this year's TBI Act is to update it and clarify it so it's super clear that it can serve people with brain injury regardless of mechanism. And I know that's true for our other efforts as well. I don't know, Denver, if you have anything else to add there.
I know we had a question from Maureen about how a state can get or access grant money. What does that process look like? And how do you start that? So I can kick it off. Every state who wishes to have an ACL grant has to identify a state agency to take lead. So advocacy starts at your state with contacting your governor, your local representative, your state representatives to help you navigate that space to find an agency. Zeta, do you want to take that on, the second part there?
Yeah. Once you have a state lead agency, there is often solicitations that the Administration for Community Living puts out, and you apply to be a grantee. I will also say that you can have a university who is designated as your state brain injury lead, be the state lead if that's needed for capacity within your state. And then you'll apply for the grant funding. Currently, we are funded for all the states that we have funding for. So that's why it's super important that we also advocate at the federal level to ensure that we can get that increase in funding so that more states are able to apply. It's also important that we can make these changes to the TBI Act so that the state match can decrease. As we know, that's often a barrier for states in being able to apply for the funding as well, because the match is significant. So it all kind of ties together, but absolutely agree, can start making those requests within your state to be able to apply, because we would love to see more states apply, and states to continue partnering with their affiliate organizations as well in their application.
Wonderful. And then to back off the ACL grants, can you share more references about cost savings in states that have this SPP, State Partnership Program?
Yes, I will put it in the chat.
Thank you. All right. How many survivors will be able to speak? So if you are joining us on Capitol Hill, which I hope you are, registration did close Sunday, so we have a bunch of people coming. We're so excited. You will be put into a group of folks from your same state. And you will have about 15 minutes in that meeting with that group. We hope that everyone who wishes to share during that meeting does share. during our, and actually we have an online training as well, we have a segment about how to share your story and how to frame it in preparation for our day on the hill. So if we want all everyone in that group to speak, granted, great, we love that. We just need to make sure we negotiate that 15-minute space. We make sure we hit on all our asks and we allow space for questions. So there's no limitation, right? If there are 5 survivors in a group of 5, we want all of them to speak. If there's one in a group of 6, we want that one to speak, right? We want to make sure we have as many voices elevated, especially our survivor community. Oh, more state stuff about ACL. I love this. Maybe we need an ACL thing. Who decides to pay the match? That is dependent on your state and your state budget. So if your state legislature, excuse me, does not prioritize this and does not set aside that $100,000 a year match, it doesn't happen. So it's upon you and your state legislature to make that possible. You can always also work with your governor who sets the baseline budget each year, or each budget year, excuse me.
The match can also be met in part by in-kind, so that's often a way that states are able to meet that match. And NASHA is happy to help support states that are interested in applying for the funding and thinking through ways to meet that match and work with their states to make those changes.
Wonderful. All right, I'm going to answer 2 more questions quickly, and I think we're going to have to wrap up. If you want to get more involved, we at BIAA have affiliates across the nation. So if you type in Brain Injury Association, Rhode Island, Brain Injury Association, Florida. It can connect you with the folks on the ground. If you don't see a state affiliate there, you can always connect with us at advocacy@biausa.org, and we're happy to get you engaged. National also has a really great base as well of state agencies and supporters where you can get engaged. And then Barb, I'm going to answer your question. So we will, March is Brain Injury Awareness Month. So we will have, if you're not joining us on the Hill, we do have a variety of things you can do at home. Advocacy always starts at home. It starts at the kitchen table. So we will be sending emails about that. If there's a link for you to send a letter to your legislator, excuse me, at the congressional level, that letter is already pre-written for you. All you have to do is put in your name, your address, and it formats it for you and sends it off. We do allow space for folks to edit anything because personal stories are huge, but keep an eye out for those. Those will be called our quorum campaigns. That's the data or the website that we use to facilitate those. But it will be as simple as putting in your basic information, our system figuring out what district you live in, what state you live in, and getting those letters ready. And we'll be a little bit more clear in those emails of how to do that. So thank you. All right, it looks like we hit the top of the hour. Santa, do you have anything else?
No, just thank you all so much for coming today, for learning, for advocating, whether you'll be with us or not. And thank you so much to BIAA for their partnership. We truly are so grateful for the collaboration and all the work that it takes to put on a successful event, and are looking forward to seeing many of you in person soon.
Yeah, see you all soon. If you have any questions, please shoot us an email at advocacy@biausa.org. Thanks all. Have a good night.